The old Tiaho mai, which is right next door and was on this site previously, was built about 20 years ago, 52 beds. But the problems that we've had with that is, one is our population's grown, so it wasn't able to be expanded or extended. So at that point in time we had a real issue to solve. How do we get a new building with more beds to serve the population we need?
They really wanted to create a welcoming environment, probably something that mental health units haven't emphasised in the past. They wanted to create a sanctuary for their service users. So it's about integrating views to nature, natural materials, light, volume, space, the quality of air, quality of acoustics, all of those things together to provide the best environment possible.
The new half, beautiful. Not just in its appearance, but beautiful in the sense that our tangata whaora, our patients, are going to thoroughly enjoy this. They've got a bigger room, there's space there for a whānau member to come and stay with them. Here they're treated with more respect, in my eyes anyway, than the old building.
As we've come to make decisions, we've held true to that. So there have been times when we've needed to prioritise, and so we've held at the centre what our people have told us about what's important to them, and we have made decisions based on that.
One of the designs here is that instead of staff being at the end of the ward with a whole lot of beds down a long corridor, we are in courtyards and around a courtyard with nursing stations or substations across the different parts of the courtyard. So the staff can see what's going on around them very easily, but also be able to support one another.
We've put out interactive centres in the areas, in the shared spaces where service users are as well, and in those interactive centres we've tried to design them with the clinical staff's input to have available to staff everything that they need to do their job out where service users are.
So another unique aspect, which is a bit more functional, is the zoning of the building from the very public to the very private, which is the bedroom. Orderlies and things from the main hospital, when bringing in food or bringing in clean linen or taking out rubbish, will have a very clear path as to the way they go in and go out, and also they will only get access through to certain areas. One of the challenges we had early on was to try and to make 76 beds work as one. One of the key features obviously is that they're all single rooms, so every service user gets their own space and they all get their own ensuite, even in the high care areas.
In the bathroom doors, we looked to see, well, what could we have? We needed to ensure privacy, but we needed to ensure on-site as well. And the doors that we had were on a patent in England, and we couldn't get them, and they were going to be incredibly expensive if we did. Wanda went out and she searched and sourced, and we tried lots of things. We had people trying them over here. We had to look at the patent. We had the Māori and Pacific Reference Group helping us with the design. Nothing has just been, oh, we'll have that. Everything's been really thoughtful.
We've got lots of other design features, so that's about safety and security, modern alarm systems. We've got flexibility with completely Wi-Fi enabled, so we can have the latest electronic and computers equipment so people can access results and clinical records and all of that on a very mobile, flexible basis. Really it's catered for not only patients and their families, but also the staff to create really what's a state-of-the-art, unique facility in New Zealand, and allowing us to take a big step forward in the provision of acute mental health care.